নমস্কার শিউরি, শুনছেন গীতাঞ্জলি রেডিও 90.4 FM, শিউরি শহরের প্রথম এবং একমাত্র কমিউনিটি রেডিও স্টেশন। দিন দুপুর রাত কিংবা হোক ভোর, আমরা আছি পাশে রেডিও 90.4। আমি সোমা চলে এসেছি আজকে একটি নতুন শো নিয়ে, যেখানে আমরা কথা বলবো নার্সিং নিয়ে। নার্সিং নিয়ে আমরা কতটাই বা জানি, আর তাই আরও বেশি বেশি করে জানার জন্য আজকে আমার সাথে আড্ডায় রয়েছেন সিরিসেটি অ্যান্থনি স্যার। স্যার হিন্দি এবং ইংরেজিতে বেশি কমফোর্টেবল, তাই আজকের সেশনটা আমরা ইংলিশে করব, মানে স্যারের কাছ থেকে আমরা ইংলিশেই শুনবো, যদিও উনি বাংলাটা খুব সুন্দর করে বোঝেন। ফার্স্ট অফ অল স্যার, ওয়েলকাম টু গীতাঞ্জলি রেডিও। হাউজ ইউর ডে?
Yeah, madam, it was fantastic. TikTok cholchi Bangla mein.
ঠিকঠাক চলছে।
Yes, madam. Exactly.
So, sir, we will discuss about nursing.
Exactly.
The first question comes to mind that what's nursing?
Yeah. So I can say that, let me tell the first thing is what is nursing. So here it is telling the abbreviation of nursing. N is nothing but nobility, U is nothing but understanding, R is nothing but responsibility, S is nothing but sincerity, and E is nothing but efficient. Means being a nurse, these are all the categories, these are all qualities we must maintain. And let me tell, it is a noble profession. In our old, the evergreen profession in the medical, the first one is a doctor, the second one is as well as nurse. The nurse who can stay with the patient 24 hours. The doctor will come for advice, for prescription of the medicine, whereas the complete follow up care will be taking place by the nurse.
Yes.
So nursing profession is a well evergreen satisfaction profession. And also let me tell, here there are different kinds of the nurses are there. What the peoples used to think in our life daily routine, the nurse is nothing but nurse. No, there are different kinds of the nursing professions are there. Let me tell you a few things. The first nurse will be ANM. It will be the auxiliary nursing midwifery. The course duration is the 2 years. Whereas the next one is a GNM, General Nursing Midwifery. The course duration is a 3 years. And GNM is a diploma course, whereas the next one is a BSc. It's a graduation course. It's about 4 years. And next one is a MSc. So after BSc, you can go for the PG level. That is nothing but Master of Science, MSc. So within the MSc, there is different kinds of the branches are there. The specialty of the PGs. Here it is pediatric. Here it is obstetrical gynecology and community health, psychiatric, as well as medical surgical nursing. These are different kinds of the branches. After completion of the Bachelor of Science, you can go for Master of Science within the nursing, as well as nurse not only within the UG level, PG level, nurse also can be become as a researcher, nothing but PhD. He can or she can go for doctorate. So this is the journey of nursing. Yes, madam.
A huge path, a long distance we can cover.
Yes, exactly.
So, you have told me the abbreviation of NURSE,
Exactly.
the qualities. We will
Exactly.
talk about this later. But if I wish to join, I wish to study nursing,
Yeah.
what should be my qualification
Yeah.
in different of genres?
Yeah. So basically, as per Indian Nursing Council, our regulatory bodies, that is Indian Nursing Council. So what our council is telling, in order to join for the GNM or BSc, some maximum the qualification, essential qualification is HS. So here it is in the West Bengal, you can say HS. In our Andhra Pradesh, basically I am from South India. So in our Andhra Pradesh, it is called as intermediate. It's
Okay.
nothing but 12th standard. Is it? So here, HS is a essential qualification in order to get the admission for the GNM and BSc. So in the HS, you need to get a 40 to a 50 percentage. That is a basic you must get within the HS. And one more thing I need to tell, in the West Bengal, so in order to get the admission in the GNM as well as BSc also, this is very the best criteria has given by the West Bengal. There are two kinds of entrance test. For the BSc nursing, there is a Gen Pass, as well as for the GNM, there is a West Bengal ANM GNM entrance test. You must get the eligibility after writing these two entrance test, then you will get the admission under the West Bengal. There are the different kinds of the states according to the state level. Different kinds of the entrance tests are there as per the INC rules. Whereas in the West Bengal, there is a two entrance test for the GNM as well as BSc also.
Uh, I should complete the HS
Yeah,
with science stream.
exactly. So here it is. For the BSc, there is a mandatory you must have science background. Whereas for the GNM, you must have science as well as you can go for it arts or whatever normal also, no issue. So there is a mandatory for the BSc science background, and it is not a mandatory for the GNM. You can go for any stream level. That's
You have told us that R stands for responsibility.
it. Yeah,
What are the responsibilities?
yeah. My personal opinion, what is the meaning of responsibility to be as a nurse? Let me tell, madam, within the hospital, within the operation theater, within the ICU, there are different kinds of the patient sick and they admitted in the hospital, and we are the staying within the hospital in front of the patient to cure the disease condition. Let me tell, there are the relatives, neighbors who is standing outside the operation theater, outside the ICUs. So they are thinking, what will be happen for my child? What will be happen for my daughter and son? In that case, the nurse is responsible. The nurse can understand, I can do, I have to do in order to save the patient life. That is our responsibility. It is a clinical sector. Coming for the education sector, being a professor, being a teacher, so our responsibility always we must give the quality of education. When we are giving quality of education, they will provide quality of care. There is a connection in between the college and hospital. When we are getting preparing the person in the quality level, they will give ultimately quality of care. That I can trust it. That is the
Yes.
meaning of responsibility, madam.
We say that doctors are next to God.
Exactly.
And we also say that nurses, especially the BSc nurses or MSc nurses, they are next to doctors.
Exactly.
How much truth lies in that statement, in my statement?
Exactly. One of the researcher is telling, you can imagine in the human body, there are two organs are very important. The first thing is a heart, the second one is brain. Without brain, we can't survive, as well as without heart also we can't survive. Let me tell in the medically I can tell an example. Heart gives the blood supply for the all the parts, whereas the brain is giving signals for the all the body parts. You can imagine, without blood supply for the brain, nothing. Without giving signals to the heart, nothing. I can say the brain is a doctor. You just imagine, the heart is a nurses.
Wow.
Absolutely. We need to agree this scenario because nowadays within the health sector we are seeing the coordination, the teamwork without nurse and without doctor. So must be they must be mutual understanding and communication together. They need to go for treatment. Yes, madam.
Very interesting. So, sir,
Yes, madam.
you have told that the patient parties,
Yeah,
quote unquote,
yeah,
neighbors, family,
Yeah.
relatives are standing outside to get a feedback.
Hmm.
How much important it is to communicate with them, maintain a good relationship, a good behavior
Hmm.
for a nurse.
Yeah. So, being a nurse, always we must maintain the communication. Let me tell, nurse is not only communicate with the patient. Nurse has major role to communicate within the hospital different personals, such as the relation. I mean, the communication in between nurse and doctor is a mandatory. Nurse and patient is a mandatory. Nurse to nurse is a mandatory, and the nurse and guardians, in the sense nurse and patient relatives, mandatory, because the nurse only can stay 24 hours within the in front of the patient. So whatever the information related to the patient, the nurse only can do. So the thing is, all the nurses, we have given by INC one proper ethic. We must maintain uh, request, and we must maintain respect. Always we must maintain respect with others. When we are respecting the patient, ultimately everything will be happen. That is our motto.
There's an allegation that nurses don't behave well in many sectors. Why is it so?
Actually, I won't agree with this. Why? Because uh, there is little challenges in our medical profession. Being a nurse, the first challenge is stress. You can take an example. We have night duties. Night duties timings will be start around 8 p.m. It will end 8 a.m. There is 12 hours duty. Even a single second also we can't sit. Even single second also we can't get relaxed, because during the night duties, the what is my experience I'm explaining. I had seen lot of the cases in my experience. More more of the cases get the bad, means most of the cases will die during the night only in the hospitals, especially within the ICUs. So 20, I mean 12 hours duty, every second we need to keep on observation. Always we must observe. So in that cases, we will get some physical stress, we will get some mental stress. So such a things only the challenges. Rest of the everything is, so we are delivering our care maximum our level best. I think so.
Of course. We get a term documentation.
Yeah.
What is
Yes.
the importance of documentation in nursing?
Yeah. Documentation is uh, not only important for the nursing, but also it is very precious document we need to maintain within the hospital. Madam, uh, for suppose there is a one example I can tell, consent form. So let me tell what is the meaning of consent form. So before entering into the operation theater, this is a common thing everyone knows. So the doctor or nurses will give the one form to the relatives, do the signature that during the operation, during our treatment, we are not a responsibility. So it is a common ethic we must maintain. So consent form is a very very important to get the signature from the relative. That is one of the legal document we must maintain, as well as follow up care. If you go for the ICU, madam, actually, uh, 10 years back, I mean 6 to 7 years back, I worked as a nursing officer within the CT ICU, cardiothoracic ICU. There is a big chart, that is a 24 hours chart monitoring, that is called as follow up care chart. The chart, if you're seeing the chart, the complete each and every second what the nurse is doing for the patient. If next second what we supposed to do, if last second what we had, everything is recorded within the chart. That is very mandatory. And one more thing is provide the quality of care. If you want to provide the quality of care, the quality of records is a mandatory within the hospital. So these are the uh, some documentation I have explained. A lot of the documents we have to maintain, as well as clinical sector and educational sector also within the college level.
A term is returning in your speech, that is ethics.
Yeah.
We have learned, we know about the ethics of doctors, ethics of policemen.
Yeah.
So, what is the ethics in? What are the ethics in nursing sector?
I can say mainly we are following three kinds of ethics in our medical profession as well as nursing also. The first one is respect, the second one is confidentiality, and third one is non malpractice. Let me tell what is the respect. As we know that give respect and take respect. But being a nurse, always we must give respect only. We are not expecting respect from the patient. Can I tell example? The patient on sick, the patient on OT table, the patient on ICU. How we can expect the respect from the patient? So, being a doctor, being a nurse, being a medical profession, always we must maintain the a golden ethic is respect. Give always respect to the patient as well as confidentiality. What is the meaning of your confidentiality? The patient is coming with the disease condition, might be whatever disease condition. Being a medical profession nurse, we should not tell to something to someone, whatever it may be. We should not share the things to the someone. So that is meaning of confidentiality. We must maintain whatever the data with us only. And as well as non malpractice. We should not do the malpractice. If you know the quality of care, that is I am telling. So I am the professor. So here in the West Bengal, when we are giving quality of care, I told you already. Ultimately, the student after becoming as a nurse, the professional nurse, she or he will give the quality of care. In order to give the quality of care, if they are giving quality of care, how the malpractice will happen? So being a teachers within the nursing education, nursing institution, all the teachers, all the professors, the principals must focus on the quality of care. If we are giving quality of care, the quality of care definitely it will happen. Might be in our life, in our family also, maybe someone will get hospitalized in future. So always we must focus on quality of care.
You said he or she.
Yeah.
A decade back, if I go a decade back, he
Yeah.
was not in the
Not.
nursing
Yeah, exactly.
profession.
Yeah.
But now,
Yeah.
male
Yeah,
nurses,
exactly.
brothers
Yeah.
are there.
Yeah.
How it is it happened?
Exactly. There is a scenario, madam. There is a we have one history in the nursing profession. That is, I can say, pre-Vedic period, post-Vedic period. This is one of the model. I will tell briefly what is the meaning of pre-Vedic period. So our Indian Nursing Council was established 1947. So you can understand before Independence Day, after Independence Day. The before Independence Day is called as pre-Vedic, after Independence Day is called as post-Vedic. The before Independence Day also the nursing was there, but it was not a profession. Whereas our mother, nothing but the Florence Nightingale, she is our leader. She made our course as a profession. She took the challenge, why only the women do nursing, why the boy can't. So she established university programs, she established BSc, she established MSc. She's the founder. So that's what all the men or women can do the nursing. So here there is no gender bias. Means to provide the quality of care, what the gender can do, male or
Absolutely.
female, everyone can provide the care. Absolutely.
Soft skills. We can get
Exactly.
a term.
Exactly.
Can male nurses provide the soft skills?
Of
What
course.
are the soft skills?
Yeah.
Tell us first.
Yeah. There are the few soft skills, let me tell. The first one is a communication. Within the hospital, the communication is a much more we must maintain. Communication with the patient, communication with the doctor, communication with the relatives. So how we are giving the communication, that is a mandatory here. There is two kinds of the communications are there: verbal communication, non-verbal communication. For suppose there are different kinds of the students within the class. I am telling example in the education. There are 100 students are there, and 50 students are giving good feedback to the teacher, and few students is not giving proper feedback. Why? Because it's depending on the teacher. When the teacher is giving good communication with the student, then ultimately the output will be the good. So communication verbally, non-verbally in the sense through our facial expressions, through our movements, that will be effect in the hospital as well as within the education sector also. Next one is time management. Time management is very very key to get the success. Nowadays, I said in the first session only, entrance test. This is a time for in the West Bengal to appear the entrance test. So the students must be get the time punctuality, time management to get the eligibility. Next one is a punctuality. Being a teacher or being a medical professional, being a nurse or doctor or student, whatever, our Mahatma Gandhi is telling that the punctuality is a weapon to get the success. When we are being a punctual person, no need to worry. Ultimately, the success will come for us. Yes. And next one is teamwork. So, being a principal or being a doctor or being a nurse, we should not maintain individuality. If you are in the medical sector, you must maintain teamwork. Altogether, we must go for together. So, Abdul Kalam is telling that united we stand, divided we fall. That we must follow. Next one is critical thinking. Always the nurse must go for critical thinking. When there is a ICU, we have triage. Within the ICU, we can call in the medical term triage. What is the meaning of triage? When there is different kinds of the patients are there. You take an example of the patient with the common cold, the patient with cardiac arrest. So to whom we need to provide the care? That is called as critical thinking. That is called as logical thinking. Absolutely, we need to provide the care of cardiac
Cardiac
arrest.
arrest.
So these are the minimum essential soft skills. Being a medical person, especially being a nurse, we must maintain.
You said that entrance exam is knocking at our door.
Yeah,
Genpass.
yeah,
Uh, what are the key
yeah,
to be successful in Genpass?
definitely. It is a challenge for the students, those who are appearing for the Gen Pass. Nothing. They are already got passed, given the exam for the HS. The same syllabus: physics, chemistry, biology. These are the main subject they must focus. There are multiple choice within the entrance test, and if they're appearing, definitely they will beat it. So the thing is the punctuality and time management and concentration and dedication is very important. They must maintain the dedication, and they must fulfill their dreams. Yes, madam. Actually, let me tell, it's my personal feedback. I came from a poor family. uh, when I studied my BSc, I don't have a source to pay fee also. Whereas my poverty, my poor level has broken by education. I trust always hard work never fail. When I was in the BSc, I used to study every second, every day. My friends are scolded me. My friends are did something towards me. You are always steady. You are not doing something. So I just focused on my education. As of now, I am in good position.
Yes.
That is a success.
You told us about challenges.
Yes.
You, all the nurses have to face some challenges throughout their journey.
Yeah.
What are the challenges?
Yes, madam. Let me tell a few challenges here. The first challenge is constant learning. Not only for the nursing, not only for the medical profession, every individual within the health sector, every day is a learning. The life is a learning. From first year to, I mean, newborn until death. Every second we must get learn. So especially in the medical profession, what will happen? Every day new ethics will come, new procedures will come, every day new challenges will come. So our first challenge is a constant learning. The second challenge is high responsibility. Means in our hand every day the patient life is there. So I must maintain, this is my challenge, to save the patient life. Next one is as well, I told you already, the physical stress as well as emotional stress also. This is the things I need to maintain. And next one is stress at workplace. Workplace in the sense within the hospital. Apart from that, everything is fine. That's it.
Personal life and professional life. Everyone has to
Yeah.
balance. We have to balance. But nursing and as well as the medical profession, not only nurses, for the doctors also, how difficult it is to maintain personal life and professional life.
I had mentioned already, nursing or medical profession is a noble profession. Yes, of course, for the being a clinical nurse within the hospital, uh, there is 6 hours duty. Some of the hospitals maintaining 8 hours duty also. In certain time, we should not think what my personal life. We must focus on patient life. Being a nurse, the three things is very important: prevention, promotion, rehabilitation. Always my mind must think about how can I prevent the disease condition for the patient. Always nurse can think how can I promote the health. Always I can think how can I rehabilitate the patient. I mean, how the patient can revert back from sick to normal. If we are thinking, if we are focusing on these 3 points, why it is interference with our life? Our personal life is a secondary as of me. The primary thing is patient life. We must save the patient life, and then is our life. As uh, we know, we had a bad scenario in 2021, COVID-19. We have seen in different hospitals. Just imagine if there is no doctor, if there is a nurse during that particular bad disaster moment, then how the 2025 will be.
Of course, you were the COVID warriors, and for you, all of you, we
Exactly.
are here
Exactly.
to enjoy the session actually in the
Exactly.
Gitanjali radio.
Exactly. Exactly.
So, sir, I will come to the study
Yeah.
of GNM
Hmm.
and then BSc.
Yeah.
What are the subjects to we should learn?
Yes, sir. Exactly. So let me tell, there is different kinds of the branches are there. So for the nursing, there is different kinds of the branches are there. Let me tell, the first one is general nursing, pediatric, psychiatric, geriatric, community health, critical care, surgical, oncology. As well as general nursing can go for anything. Pediatric who can specialize for the children, psychiatric for the specialist for mental
Mental health.
patient, geriatric is nothing but old patient, old women's or men's, or community. Man, nurse not only for the hospital but also she can give the treatment in the community level also, within the villages also. That is nothing but community health nursing. Critical care, as I told you, operation theater, ICUs will come under critical care. Next one is surgical department. The last one is oncology, nothing but cancer.
Cancer.
These are the different kinds of the branches we can see in the nursing. As you asked me the questions that subjects of GNM and BSc, there is a different well interesting subjects. The first one is anatomy and physiology. This anatomy physiology not only for the nursing but also whoever coming for the medical profession, the basic subject is anatomy and physiology. Let me tell, the medical profession is dealing with humans. So why we can't read first ourselves, who I am, what is my body structure, what is happening within my body, that will be coming under anatomy physiology. Next one is microbiology, means regarding germs, bacteria, virus. So this is one of the subject, microbiology. Next one is psychology, how the patient psychology. So that is about the psychology. Medical surgical, so what are the different kinds of the disease condition, what are the different kinds of the surgical treatment, it's coming under medical surgical subject. As I told you, community health nursing. Next one is obstetrical gynecology, how the delivery process, how the pregnancy, so that will be coming under OBG. Next one is pediatric, nothing but child health nursing, it is coming under children treatment. Next one is pharmacology, nurses not only for this, nurses can prescribe the medicine also. That's what we had subject of pharmacology. Next one is nursing education, and the last one is first aid. So these are the most there is different kinds of subjects are there, but these are the well important subjects in our nursing.
In a difficult situation, uh, can a nurse, as there is a subject called
Obstetrical gynecology,
obstetrical gynecology,
yeah,
so can a nurse deliver a child
why can't?
without a doctor?
Yes, absolutely. GNM is a nothing but, the name itself is telling, general nursing
Midwife.
midwifery. The midwifery can do deliveries. Madam, we had a registration certificate the given by Indian Nursing Council. There is a license, there is a register number for nurses can do deliveries. We can do deliveries without doctor also. So that is given by INC.
So for the community health officers,
Yeah,
they can
they have to
they
actually.
have to.
They have to. Let me tell regarding community health officer. As of now, the central government has introduced one program under National Health Mission (NHM), that is within the rural level, within the root level, within the village level. If you are providing the quality of care, then absolutely the disease condition will be preventable. Always we are focusing within the village level. The prevention is better than cure. Is it? So we must maintain this kind of the things.
Respective to India,
Yeah,
not only West Bengal,
yeah,
the community health officers
yeah,
do get the infrastructure of a hospital.
exactly. Uh, you asked right question to the right person, because during my experience, 2 years I worked as a community health officer in my Andhra Pradesh. There is a good setup, a good infrastructure, the given by National Health Mission. I feel very happy. Still, I am telling to be proudly, the community health officer is a golden opportunity to provide the quality of care. Madam, there are the different kinds of the well equipped infrastructure given by central government. There is a labor table. There are the different kinds of the most probably 150 different kinds of the drugs are available. 150 plus. It's not a small issue. So labor room is there, labor table is there, and 14 kinds of the diagnostics test we can do within the subcenter level, and treatment we can provide, and referral we can do. There are a lot of the things we can do within the subcenter. So as of now, within the India, most probably 1,50,000 plus subcenters are there, and 1,50,000 community health officers are there. I'm telling, to be frankly, my dear nursing students, upcoming nursing future students, you have future golden opportunity for GNM and BSc. You are eligible for being a community health officers.
অ্যাজ দিস ইজ আ লাইভ সেশন, আমি সকলকে বলি যে যারা যে সমস্ত স্টুডেন্টরা এখন স্যারকে শুনছো, তারা কিন্তু আমাকে লাইভ ফোন করতে পারো, স্যারের সাথে কথা বলতে পারো। 9332425590 হচ্ছে আমার লাইভ ফোন নাম্বার। 9332425590 এই নাম্বারে ফোন করতে পারো, স্যারের সাথে কথা বলতে পারো। শুনছেন গীতাঞ্জলি রেডিও 90.4 FM, সিউড়ি শহরের প্রথম এবং একমাত্র কমিউনিটি রেডিও স্টেশন। স্যার, আই এম গেটিং ব্যাক টু ইউ।
Yes, ma'am.
হোয়াট অ্যাবাউট দ্য বিএসসি নার্সিং?
Yeah.
দ্য কোর্সেস আর সেম?
No, madam. There is a little differentiation in between BSc and GNM. As I said already, GNM is a general nursing midwifery. It's coming under diplomatic course. The core duration is a 3 years. And coming for the BSc, it's a Bachelor of Science. It's a 4 years course. It's a UG course. That is only the differentiation. Other than that, the same.
Subjects are the same.
Subjects are same, most probably 90% subjects are same, but everything is only diploma and graduation. But nurse is nurse.
You said about community health officer.
Yeah.
I'll get back to that. What is the scenario here in the West Bengal, in Birbhum?
Yeah. Actually, I can say in Birbhum and West Bengal, not like that. It is a policy given by National Health Mission. If in my Andhra Pradesh, if one protocol is we are following, the same protocol has to maintain in the Birbhum or in New Delhi, in Andhra Pradesh, wherever it may be, because it is a central project. The central government is running these community health officers as well as this state government also. Here there is a communication in between the state and central. That together they're giving the rules and regulations and policies and everything, and as a community health officer they has to maintain the same infrastructure, the same salary. Might be the salary will be the difference, but everything will be the same.
Okay, infrastructure is the
Ekdam,
same.
ekdam.
Okay, now I'll go to your nursing colleges.
Exactly.
You are coordinator of both the colleges of Gitanjali Foundation.
Yeah.
One is Sainthia Nursing Institute and
Exactly.
other is
Rampurhat
Rampurhat
Nursing
Nursing
Institution.
Institution. So tell us about both of the institutions one by one.
Yeah. First of all, I want to tell I am very lucky, I am very proudly I can tell to be part of here Gitanjali group of institutions, because basically you know that I am from Andhra Pradesh, I am from South India. I relocated from South India to West Bengal. On the first day I was very confused, but as of now this second I'm very satisfied, because only the Gitanjali group of institution management, chairman sir and everything. And coming for nursing institutions, I can tell proudly these are two institutions, my personal opinion, a well infrastructure, well equipped, well reputed college within the Birbhum. I can say not only within the Birbhum, I can say proudly within the West Bengal, because this is my third year. This is as of now it's a third year experience in the West Bengal. Even one day also I didn't get the bore in my institution. Such a pretty college, such a good qualified teachers are there, everything. Let me tell one by one. You can take the first institution is a Sainthia Nursing Institute. You have asked me one question that there is why can't male go for nursing? Yeah, male has to go for nursing, as per me, because I am also male, is it? So here, the INC has given the permission, the male has to go for nursing. So the Gitanjali group of institution has provided the golden opportunity for all the male nursing future medical aspirant students. Here it is a Sainthia Nursing Institute, the located in the Sainthia in the Birbhum district, especially for the male nursing students. We have two offering courses as of now, because we are planning for future MSc also. As of now, we are having a diploma, nothing but GNM, which is about 3 years course, as well as for BSc, which is about 4 years course. A fully affiliated with all the government regulatory bodies such as West Bengal Nursing Council, we had approved, as well as West Bengal University of Health Sciences, as well as a fully approved with Indian Nursing Council. So all the regulatory bodies we had. And coming for what is our the special facilities. I am telling, no, I am very proudly, I am using this word. So why I am telling proudly? Because there are different kinds of the institutions within the West Bengal, within the Birbhum also. But what is our special facilities? So there is the first, if you visit the campus, you can Google it also. The well infrastructure, well technological infrastructure. The infrastructure is having all the colleges, whereas come and visit our college and see what is our well infrastructure. We modelized the infrastructure as per the labs, the fully as per Indian Nursing Council criteria. This is the main point what I want to trying to say. And next one is each and every class is having digital class. We had smart board, we had screens, smart digital class. Every faculty, every class they are taking in digital board only. That is our facility. Next one is experienced faculty. As I told you, within the MSc, there is different kinds of the categories are there, different branches are there. Each and every branch we had faculties. MSc means if they are specialized with their the special subject, they can teach specially. So that is our experienced faculty. And the thing is, Digi library. Everyone is having library, but we had Digi library. What is the meaning of Digi library? The library books, different kinds of publishers, journals, national journals, international, everything we have. But we had Digi library means within the library we have digitalized computer systems. Not only the student can see the book, but also she or he can see the system and she can read from the Digi system also. And also we have well affiliated hospitals. Let me tell what are our affiliated hospital. Our parental hospital for the Sainthia is Asha Nursing Home. Whereas coming for this Rampurhat Nursing Institution is New Apanjan Nursing Home. So what are the affiliated hospital? The first one is Sudi Sadar Hospital and Sudi Super Specialty Hospital, which is a 1,000 bedded hospital. So huge. The student can go, can practice, can do the things there itself. And second one is Rampurhat MCH, as well as Rampurhat Medical College, as well as Rampurhat Government Hospital, which is located in the Rampurhat. That is also super specialty hospital. The bed capacity is very huge. The student can go, can practice over there. And next one is Molarpur BPH, Sainthia Rural Hospital, and Purulia Mental Health. I explained already. The psychiatry subject is there. So they can go for Purulia Mental Health. They can go for practice over there also. And Muhammad Bajar BPH. So these are the affiliated hospital, purely given by your Kolkata Swasth Bhavan, Director of Mission. So this is our facilities. Next one is especially Sainthia and Rampurhat Nursing Institution. If you visit, our hostel facility. Each floor we are having free Wi-Fi. This Wi-Fi is only utilizing by digital classroom and digi library and YouTube class. I'm going to tell this one also. We have this extra benefit YouTube class. The student during the daytime they can go for the classes. During the leisure time, during the evening and night time, they can get the classes from the YouTube. Our faculties is taking the classes by YouTube. That is an extra benefit also we have. That is why we are maintaining free Wi-Fi each floor in the hostel. And water facilities, we have each floor water facility system. And also transportation, if you want to go for the college, college, hostel to clinicals, the transportation is there 24 hours available. I can mention here we are having the self ambulance system within the hostel. Might be sometimes that things will be happen, so immediately within seconds we have ambulance system. That is extra benefit we have. And also we have playgrounds for male and female. And extra benefit is student credit card. Yeah, every student is having dream to fulfill as a nurse, a doctor, or whatever, but the thing is economical status. You have asked me my personal feedback. In our India, I feel, especially in West Bengal only, the student credit card system is there. This is the a golden opportunity for a future medical aspirant nursing student. Use this opportunity. Don't stop your education with your economical status. Break your barrier as a economical status, get the success. So that's what the student credit card is, a weapon to break your this. So scholarship, why I like this group of institution of Gitanjali, each and every employee is focusing on future of student. The student credit card system we are applying, we are following. And scholarship, private and government, we are only applying and we are only following.
Okay,
How
students
nicely.
don't need to
They,
worry.
no need to worry. We are only following, we are only doing everything. We are 100% assistant we are providing for to get the scholarship as well as student credit card also. So there is no worry to about this economical status to study the BSc or GNM as well as, especially in my colleges, I can say that. And I can say 100% assistant in placement. That is, the students will get worry after getting admission. So what is my future? So I can assure that being a nursing coordinator for the both campuses, I am giving and we are giving 100% assistant about your future. I can say that the golden evergreen profession, I used to tell this word because always the jobs there for the nurses. Let me tell a small example. Within the hospital, for suppose the doctor is needed 2 or 3, or some technicians 2 or 3, whereas nurses needed 100. The ratio you can see. The placement, why we can get the placement? We can get the placement.
Can you remember some success stories of your students? You have worked here for 3 years.
Yeah.
Regarding placement,
Yeah.
what can you remember?
Yes, exactly. So last batch, I am taking an example of last batch. To be frankly, I am telling very proudly, both nursing institution, Sainthia Nursing Institute as well as Rampurhat Nursing Institution, for last passed out batch we got 100% success.
Within West Bengal or all over the India?
Within West Bengal as of now I can say. And 100% we got pass, and among them 90% got placement. We had different kinds of the branches overall India. We had affiliated with Apollo, Manipal, at the Bangalore, Hyderabad, Kolkata, different kinds of the hospital we have tie up. So the placements are over there. So this is very happiest moment I'm sharing with you, as well as for my audience also. So my dear students, your future is there, and we are here to show your future, definitely.
We have another opportunity, that Gitanjali Coaching Center,
Exactly.
to join and crack the examination like GenPass or
Exactly.
ANM GNM.
Exactly.
Please tell us about that.
Yeah. So one more time telling why our institutions and why my Gitanjali group of institutions is the best in Birbhum and as well as West Bengal, because free coaching center means our target is the future of student. Everyone dream is to get the success, but there is no proper guidance, there is no proper coach. So we started free coaching center to show the good future to the student. Here it is ANM GNM to crack it, and BSc also. For the BSc, as I said, for BSc entrance test is a GenPass, and GNM is ANM and GNM West Bengal. So these are the two. Currently the classes are running online as well as offline also. It's a purely free. So as the madam has told you, so if you want to join in our free coaching center in order to get the uh, admission overall in West Bengal, or the thing, what is the thing, we are giving free coaching center the direct admission to our nursing institution. It's a fantastic things for the student. The responsibility only, you just join the coaching center, get the eligibility and take the admission and fulfill your goal. And we are here for your future, for shaping your future, especially I can say that.
Actually,
Yeah.
it is fantastic and a golden opportunity. তো আমি সবাইকে বলবো, যারা শুনছো এই মুহূর্তে, যারা এইচএস দেবে, তারা প্লিজ যোগাযোগ করো গীতাঞ্জলি কোচিং সেন্টারে, অ্যাবসলিউটলি ফ্রি। স্যার যেরমটা বললেন, সবাই শেখাবেন তোমাদেরকে, এবং যাতে করে তোমরা ট্র্যাক করতে পারো তোমাদের এন্ট্রান্স এক্সামিনেশন এবং ডিরেক্ট অ্যাডমিশন টু গীতাঞ্জলি
Group of
গ্রুপ অফ
institutions,
ইনস্টিটিউশনস,
Sainthia and Rampurhat
রামপুরহাট
nursing
নার্সিং
institutions.
ইনস্টিটিউশন। সো আমাদের সময় একেবারে প্রায় শেষের দিকে। আমি আপনাকে একটা শেষ প্রশ্ন করব। কামিং ফ্রম আ ডিফারেন্ট স্টেট, ফ্রম আ ডিফারেন্ট ল্যাঙ্গুয়েজ, টু অ্যান অ্যাবসলিউটলি নিউ অ্যাটমসফিয়ার, how difficult was it to cope up, to adjust, and
Yeah.
who was your best friend, or who is your best friend here in Shuri?
Good question. uh, yes, when I came here in West Bengal, I have seen everything. The culture is different, the food habits is different, everything is different. But I'm the nurse, means I had quality of adjustment, coping mechanism. We have one of the subject, psychology is one of the question also. Coping mechanism, nothing but wherever we goes, we must adjust with our surroundings. So the first month, yeah, being a human being, I had faced lot of the issues for understanding the scenarios, understanding language, to cope with the food habits and cultures. But now you can see completely I am satisfied. Even every second I am enjoying my life here, and I am doing my job here. And I asked my one question, that who is my best friend? The group of institutions under the Gitanjali, everyone is my best friend. I feel it is my family, second family. Uh, there is a chairman sir and chairman sir sons. They used to tell, "Sir, this is your second family." That word give me a lot of strength, lot of positive vibes. Yeah, that is giving so much of positive vibes for my future.
I would say your mentality is your best friend. To cope up, to adjust, and to be a family member to us, to
Exactly.
our Gitanjali group of institutions or Gitanjali Foundation.
Exactly.
So tell us that Maj Bhat is okay to you now.
Yeah, March bath, dim bath. Everything is fine. Yeah, and but the thing is, food habits little bit different. Means West Bengal used to take more potato. I used to tell every time. So, but it's good, good diet.
So how's the session here in Gitanjali Radio? You are senior to us because you are here before us.
Exactly,
Um, you are a member of Gitanjali Foundation, but first time we are having you in Gitanjali Radio
exactly.
before me. So how was the session?
Yeah, my feedback about this session, I feel very happy today. Means this is a platform to express my feelings about my personal career, about my college, about especially nursing. So it is very a golden opportunity I got today from Gitanjali Radio. So I can encourage the all the categories, not only for medical profession, all the profession within the West Bengal or Birbhum district. I encourage the radio station is a platform to share everything to anyone. So
Absolutely.
I'm very happy to be here for this session. Thank you so much for this opportunity.
As this is a community radio station, we ensure quality of care as
Yeah,
you
yes,
as
yes,
you
yes.
told. So there is also a sector, education sector.
Yeah.
So আমরা কি আপনাকে পাচ্ছি আবার ভবিষ্যতে এরকম সেগমেন্টের জন্য? আমি বাংলায় প্রশ্নটা করলাম।
और एक बार
Can we have you for more than one time, for more than once, for this session for education,
of course, definitely,
for digital classes through
definitely,
Gitanjali Radio?
definitely. I can promise also.
Okay.
Yeah, yeah.
So, thank you so much for joining us for this session. Thank you once again.
Thank you
I-
so much.
শুনছেন গীতাঞ্জলি রেডিও 90.4 FM শিউরি শহরের প্রথম এবং একমাত্র কমিউনিটি রেডিও স্টেশন। আমি সোমা রয়েছি আপনাদের সঙ্গে। আমার সঙ্গে আজকের এই সেশনটাতে ছিলেন সিরিসেটি অ্যান্থনি স্যার, যিনি গীতাঞ্জলি গ্রুপ অফ ইনস্টিটিউশনের নার্সিং কোঅর্ডিনেটর ফর বোথ দ্য কলেজেস অফ সাঁইথিয়া নার্সিং ইনস্টিটিউট অ্যান্ড রামপুরহাট নার্সিং ইনস্টিটিউশন। তো যারা এই মুহূর্তে এইচএস পরীক্ষা দিচ্ছ তাদেরকে আবারও বলছি, তোমরা জয়েন করো গীতাঞ্জলি ফাউন্ডেশনের সাথে। আর যদি কোনোভাবে ইকোনমিক্যাল তোমাদের কন্ডিশন কোনোভাবে যদি বাধা হয়ে দাঁড়ায়, তাহলে সেটাও কোনো বাধা নয়। যেমনটা স্যার বলেছেন, আছে স্টুডেন্ট ক্রেডিট কার্ডের ব্যবস্থা, আছে স্কলারশিপ প্রোগ্রাম। আর সেই সব কিছুর জন্য কাউকে কোনো রকম মাথা ব্যথা নেওয়ার কোনো দরকার নেই। সবটাই এই কলেজ, তাদের ফ্যাকাল্টিরা, তাদের স্যার নিজে বলেছেন পুরোটাই তারা নিজেরাই ব্যবস্থা করে দেন। তাই জয়েন করো। আর যদি ভাবো যে এন্ট্রান্স এক্সাম পাশ করব কি করে, তাহলে ফ্রি অফ কস্ট জয়েন করে যাও গীতাঞ্জলি কোচিং সেন্টারে। আজকে সময় একেবারে শেষ, তাই এখানেই সেশনটা শেষ করতে হচ্ছে। স্যার প্রমিস করেছেন যে আবার উনি আসবেন আমাদের সাথে গল্পে, ডিজিটাল ক্লাসে। তাই আজকে এখানে শেষ করছি। আমি ছিলাম সোমা, সকলের সাথে আজকে এখানে শেষ করছি। শুনতে থাকুন গীতাঞ্জলি রেডিও 90.4 FM শিউরি শহরের প্রথম এবং একমাত্র কমিউনিটি রেডিও স্টেশন। দূরে থাকি তবু যেন আমরা জুড়ে থাকি।